that you have an upcoming review. So we want to talk a little bit about that today. So some of the major and main things that you can do to be prepared is understanding the rules that apply to you, understanding the compliance process, developing a system of self-compliance, and what does that look like? We'll talk about that. And then just staying up to date. So bear with me for 1 second. I am going to see if I can figure out exactly how to share my screen on here. And Heidi, you might have to give me access, but let's see. We'll see if we can figure this out. I'm a new Zoom user. I have mostly been a Teams user for the years, so um, it does not look like I have that ability. Oh, yes, I do. There it is. I see it. It's just in a different place than I'm used to it being. All right. Can you guys see my screen with the DODD website on it? Wonderful. Thank you, Haida. All right. So when we talk about understanding the rules, when we talk about understanding the compliance process, it really starts with knowing where to find those things. So we're just going to take a quick little trip through the DODD website. I am going to kind of give you just a quick warning or update. DODD and all state agencies that accept Medicaid have received some new requirements from the federal government on accessibility to their websites. So if it means that they have to make sure that people who receive Medicaid services are able to access and utilize their websites. So obviously, with the Department of Developmental Disabilities, we have people that have different needs on how they can utilize and access the information on the state's website. So they are in the process of reorganizing. They're taking down a number of documents, and my understanding is over the next 90 days, they're going to be looking at how to share that same information in different ways. So a lot of the resources that I know I regularly depend upon, you're going to click on that button and you're going to get an error. And that just means they've taken that resource down. For the time being, if there's something that you need, for instance, there are templates for homemaker personal care documentation that you can usually find on the website. If you try to find that and you get an error message, you can send an email to DODD through the contact us at the bottom of the website. I'll show you where to get to that. And you click on contact us. And you can send them a message. My internet's being slow. And just tell them, I can't access the HPC template. Please send me a copy and give them your email address, and they are guaranteeing that they will send those to you. So just wanted to let you know and make sure people knew this is a great way to communicate with the department if you have questions, if you want to request a form, whatever. So this will be helpful as we talk about accessing things on the department's website. So let's go back to the main page. Maybe. Well, now their link's not working. Let's try it this way. There we go. All right. So first of all, understanding the rules that apply to you. So if you go to the main page and you click on forms and rules, and you look for the rules that are currently in effect, it will take you to a list of all the rules that apply to the services provided by the Ohio Department of Developmental Disabilities. And some of the ones that are specific to you all as independent providers are going to be the rules in Chapter 5123-2. This is the provider standards. This is things like background checks, compliance reviews, and kind of understanding that compliance review process, implementation of behavior supports, rules about managing personal funds, and then the provider certification rule for independent providers. So that chapter is important to you to be familiar with. And then as independent providers, the other ones that are of some importance are the performance of health related activities and med administration. So if you're doing med administration or if you are providing support through delegated nursing, there's a number of rules in this chapter that you might want to take a look at. And then the big one for you all is under chapter 5123.9. And this is all the rules that apply to home and community-based services through our waivers. And there's a lot of them. I think there's 38 or so of them. The reason there's a lot of them is that there is a separate rule for each service that can be provided under the waiver. So specifically, if you are providing, trying to get to homemaker personal care, let's do transportation. If you are providing transportation, then 5123.924 is going to be the rule that outlines all of the qualifications for a provider, all of the requirements, the documentation requirements, things like vehicle checks, anything related to transportation. So it's really important, again, in being prepared, that you know what services you're authorized to provide and that you are familiar with the rules that guide those services. So when you click on the blue link, it's going to take you to the language, the specific language that's in the law. So unless you're like me, who has an affinity for rules and laws, and you like to read at night or in your downtime, which I actually do, it's not super fun to read through these. But again, it's really kind of important to at least get to these sections where it says an independent provider will, what the requirements for service delivery are, what the requirements for documentation services that you are providing. So that's the first thing I wanted to show you as a way of kind of helping you get to things that can help you be prepared. I want to take us back to the main page of the website. And I want to take you again to another tab at the top. This is called Supporting Providers. And this is where a lot of resources live that are really meant specifically for you. You'll see here in the middle is a tab for compliance. If you click on this tile for compliance, it's going to take you Office of Compliance's main page. You're able to see who the managers are in the compliance team. So if you're having a compliance review, you have some concern, you have a question that you want to take up to the manager level, you can find who they are here. But the thing that is probably the most important here are the provider resources. These are compliance related resources. The first section is about the training series that the department offers free of charge, and you can sign up and register for those. And then the second section is compliance review tools. This is where you can find the review tools that are going to apply to you. So you'd be looking for the ones that are independent provider compliance tool and independent provider required documents list. These are updated at least, they're supposed to be updated quarterly. So I would expect there should be one coming for the first quarter of 2026 very soon. And they're posted as they're updated. So you can always keep track of the up-to-date requirements through the compliance review tool. If you open the compliance review tool, you're going to be able to take a look at every question that the provider or that the reviewer is going to ask you. And then you're going to also be able to look at the guidance. So that's to help you understand what they're looking for. So let me take you to one that's a little simpler here. Okay, so for instance, under behavior support, you'll see that that is a core question, which means it applies across the board to all providers. It's in the section of behavior support. If you get a citation, you will get it noted by the question number on your citation report or your survey report. And then it also gives you the rule that applies. So again, if you know how to go to the rule, you can actually be like, I don't understand why they're asking for this. Like, where is that in the rule? And you can actually go to the rule and find that question or the related rule requirement to that question. So this one says, is there a provider record of the date, time, duration, and antecedent factors regarding the use of restrictive measures? And it's telling you that what they're looking for is duration only. For all other behavioral support interventions, you would have to have the date, time, and the factors that precipitated the use of the restrictive measure. But oh, by the way, if you do something other than manual restraint or mechanical, you don't have to have a duration. So this is just to help you kind of understand what it is that the reviewer is going to be looking for. Personal funds, here's another one. If you are assisting the person with let's see, if we're assisting the person with personal funds, did the independent provider ensure that account records include a ledger with all required elements and evidence of reconciliation? Oh, well, what are those required elements? Oh, look here in the guidance. Your ledger has to include the individual's name, the source of the money, the amount of the money, the date they received the money. So again, this will help you better understand exactly what it is that the reviewer is looking for. So with rules and understanding the compliance process being two of the fundamental ways that you can be prepared, I wanted to make sure that you knew how to find those on the department's website. My boss many years ago said this is when I worked at the department, our review process really is an open book test. And it really is. It's all right here. It just takes a little bit of time commitment and strategy in utilizing these resources that are out there for you to be prepared and be ready for your review. So I'm going to stop sharing because I think that's everything I needed to share as far as what's on the website. I lied. I'm going to share one more time. One more thing. Sorry. Because the other part of this is staying up to date. And I want to make sure you know how to do that as well. So let's go back to the department's main page. And we're going to scroll down to the bottom, the same place where I showed you about the contact us. There's also a subscribe link. And if you click on subscribe, you're going to be able to sign up for email updates that come directly to your mailbox. And down at the bottom, there's a list of the ones that you will want to sign up for. Looks like they need to do a little updating here. It still has our last director's name. But the ones that I would definitely recommend for you is the DODD Pipeline. That's a quarterly newsletter that the department puts out where they highlight major topics that are important to the field. DSP Connection. This is a newsletter that is specifically designed for independent providers and direct support professionals. It highlights things of importance to you all and the work that you do. It also highlights independent providers and direct support professionals who are nominated by their peers or by people that they support just as being outstanding. So if you know someone, you can certainly make a nomination or look for yourself to be in there. I also would absolutely recommend signing up for the health and welfare alerts. You're required to review those on an annual basis, so you can have them sent directly to your mailbox. Memo Monday, that is a weekly newsletter, so it's a little more inclusive of kind of regular things, where Pipeline is more those big hot items. Memo Monday is going to have general things like upcoming trainings, etc. And then the other one is rule notifications. So this one will send you a notice if any of the DODD rules change. So if you're a homemaker personal care provider and you're providing that service and there's been a change to the homemaker personal care rule, you need to know about that. And you can know about that immediately, at least prior to the implementation of the change, by getting on the listserv for the rules notifications. All right, so now I'm really going to stop sharing and let us go back to the PowerPoint. And if you want to go to the next slide, I spent half our time on one slide. Um, so I won't go into any detail here. This is really the rules that I just showed you, that you can access on the department's website and how to access them. But these are the ones that are of probably the most important to you as independent providers. And go to the next one. Again, under health-related activities and medication administration. These are the different rules that live in that section. So if you're doing self-administration of medication, you want to learn a little bit more about that or what your requirements are, you can absolutely go there and open that rule and read about that. And go to the next slide. This is also 5123-9. So this is the section that we looked at that's specifically to the delivery of home and community-based waiver services. The ones that are the most significant related to the services provided by independent providers are listed here. Obviously, there are other services. There's day habilitation, there's career planning, there's lots of other services that have rules tied to them, but generally those are not services provided by independent providers. There is an asterisk by money management, just because I want to be very, very clear that money management as a service, a waiver service, is different than providing someone assistance with their money. So if you're looking for rules and information because you are helping Anne, balance her checkbook, or you're helping her grocery shop and spend her money, you're going to want to go to the personal funds rule. But if you are providing money management, which is I may be the payee and I'm overseeing their Social Security benefits, and I'm getting paid to allocate and help them pay their bills. That's a money management service, and that would be distinctly identified on the plan. Otherwise, if you're just helping someone with their money and doing kind of regular, routine household money management things, that's a component of homemaker personal care. So just want to make sure that folks kind of understood there's a little bit of a difference there. And then also, I know that Christy and Haida have put links in the chat for you, but at the bottom, those kind of gold highlighted terms, those are direct links. So when you get the PowerPoint sent to you, you'll be able to click directly there and go to the places that I showed you on the department's website. And next one. This is also the MUI rule. Again, another rule that pertains to independent providers. So the rules that I've shared in these three slides, they're not an all-inclusive list of rules that might apply to you, but it does cover most of the common rules and rules that are referenced in the independent provider review tool. So again, I wanted to make sure that you were familiar with those, that you had a link on where you could go to actually access them, and just really reiterate the importance of understanding the rules that apply to you as a vital part of being compliance ready. Because really, that's exactly what the compliance review process is, right? Is just evaluating how well you're doing at staying within the parameters of the rule, that you are meeting the requirements of the rule. And it's difficult to do that if you don't have a good understanding of the rule. And so both the review tool, which gives you the questions they're asking and tells you what rule number that question comes from, as well as the rules themselves that you can access on the website, are both great places to gather a better understanding of the rules, what your requirements are, how you should document for those services, and ways to identify maybe areas that could be a compliance issue at your next review, and be prepared to correct those before the reviewer comes on site. And having systems in place where you are regularly checking yourself, so that if you get a call tomorrow that, hey, we're coming out to do a special review because there's been a concern, then you don't have to like panic. You are like, that's fine. I'm ready. I have all of my documents. So let's talk a little bit about not only being prepared because you're knowledgeable, but what are some of the things that you can actually do? Oh, let me say this. Sorry. We will talk about some of those things that you can actually do, because next I want to go to understanding just kind of a general overview of the compliance review process. So there are two types of reviews that are done. There are just the regular routine reviews. I'm sure most of you have been through one unless you're a relatively new provider. And then there are special reviews. The routine reviews start within 9 months of your first billing. So if you're a new provider and you just started billing in March, you're most likely not going to have a review scheduled for at least the next 8 to 9 months. The reason for that is twofold. It allows you to kind of get your systems and your processes and everything all set up. It allows you to work with the team to kind of rectify any issues. Maybe, again, you start providing services and you realize, oh, this time that they've asked us to do this doesn't work for me, or the person doesn't want to do it at this time, or on, whatever. We need to make some changes to the plan. 9 months allows you to kind of get through those initial hiccups. And it also gives the reviewer 9 months of service delivery documentation, notes, and things to review to really get a good picture of the services that you are providing. And then after that initial review, you can expect to be scheduled for a routine review at least one time during your certification span. So at least once every 3 years, you would be scheduled for another routine review. And again, those routine reviews are going to be based upon whatever the current individual provider review tool is that's on the department website. There is also on the department's website, with the individual provider or independent provider review tool, there's also the independent provider required documents list. And that is going to be really important to helping you, again, be prepared for a review, in that you can look at exactly what pieces of paper, what different documents that reviewer is going to want to ask for when they're on site. And you can look at ways that you can have those readily available. There's also a special review. Special reviews are often conducted as a result of a complaint, or maybe there's been an MUI and the MUI unit will come over and talk to the compliance unit and say, look, we think maybe the MUI occurred because the provider wasn't doing what they were supposed to do. Services weren't being implemented correctly. There's a lack of training, whatever it might be. Oftentimes, the county MUI unit or even the state MUI unit will reach out to request a special review based on what is determined during the investigation of an MUI. Special reviews are typically unannounced. So generally, you're not going to get a notice that someone is coming for a special review. There are some times when there is a notification of a special review. It just really depends upon the nature of the complaint or the nature of the MUI. And special reviews are typically focused on whatever the area of concern is. So typically, if you have a special review, they're not going to come out and do the full review tool. They're going to be looking at, oh, was it a training issue? Okay, we're going to look at the training requirements. Did the independent provider have the 8 hours of required training? Were they trained by the SSA on the service plan? Do they need additional training to be able to implement the service plan? So typically it's focused on whatever that area of concern is. Either type of review can be conducted by department staff from DODD or county board staff or COG staff. County board and COG staff, and COGs are, for those of you who might not be familiar, they are a council of government. So I believe we have 7 COGs in Ohio, and generally it's where county boards will pull their resources together to hire the council of government or the COG to do compliance reviews for them or to do MUI investigations for them or whatever. So that is another entity that might be asked to conduct your compliance review. All of the county board and COG staff have to go through a training that DODD provides them so that they are ensuring that they are consistently reviewing using the correct compliance review tool, that the guidance and expectations for compliance are standardized as much as possible across the state. Okay. Few more things about the compliance review process. If you've already been through them, you may know a lot of this. If you haven't yet, as I said earlier, the notification is going to occur approximately 90 days in advance. So you will get an email which will be sent to your current email address on file. So it is very, very important that you make sure that if something changes with your contact information, that you are keeping that updated in the department's PSM system, the provider service management system, because that's where the compliance team is going to pull your contact information from. And if they're unable to contact you to complete the review, that puts your certification at risk. If the review can't be conducted, if they can't contact you, they are probably going to initiate the process of starting to take away your certification. So it's vitally important that you keep that information up to date so that you can get that review notification. When you get that review notification, you're going to find out who your assigned review specialist is, and then they are going to coordinate with you to set the date, time, and location of the review. Generally, they're going to want to access some place in which the person is receiving services. So it will kind of depend on what services you're providing. If they're coming to do a review of you and all you provide is transportation services, there's not really a set location. So they may come to your house, you might meet them at a restaurant. But if you are providing a service that is kind of location based, like homemaker personal care, and the person lives in your home, they are going to want to visit your home as part of the review process. If you are going into the person's home for services, they are going to likely coordinate with the person or their family to also visit their home during the review process. So where the location of the review is very dependent upon what services they are reviewing you for. Typically, they are reviewing all of the services at one time. So if you provide multiple services, HPC, transportation, non-medical transportation, they are doing one review to look at how you are providing all of those services. You're going to exchange contact information. They would generally already have yours, but you're going to now have theirs, so that you guys can talk and communicate throughout the process. And they're going to ensure that you have access to what's called RDS, the Review Data System. That is the system through which you're going to get the outcome of your compliance review. It is where you are going to respond to any citations that you get. So that kind of becomes your working review document, that you are going to access to respond. Well, first to read it, then to respond to it. So the review data specialist or the review specialist is going to work with you to make sure you have access to that, so that you can get that report when the review is completed. You will also receive the required documents list that I told you about. So you're going to know ahead of time, these are the documents you should have ready, but don't wait till that 90-day notification. You can go online now, find out what the review document list is, and you can absolutely look at how can I make sure that I know exactly where these documents are so that they are ready at any time in case of a review. Oh, hey Deb, we're seeing your screen. Can you go down where it says stop sharing? Thank you. So like I said earlier, just also understanding that the review is an open book test. So you can access and prepare for your review. You will also get, when the reviewer is setting up the review, a sample key. So if you are serving more than one person, they may not include both people in the review. So they may only say, we're going to review you, but we're only going to look at Ann's documentation. We're not going to look at Haida's documentation. So again, that's going to help you understand whose stuff do I need to have ready at the time of the review. Okay, go to the next one. So how can you be more prepared for a review? So first, you can start building small and repeatable compliance habits. Daily 2-minute documentation checks. Maybe you do, I called it a Friday file fix, right? Like every Friday, I go in and I look through the person's file. I make sure that I have signed and completed all of the documentation. I make sure that if there was a UI during the week, that I've completed the UI report. I make sure that if I'm responsible for assisting the person with their money, and that week we went out and we went grocery shopping, did I include that grocery trip in my ledger? Do I know where the receipt is? Because if you're like me, you got to dig through your purse and find all of those receipts. I will never forget, one of the first reviews I went on when I started with the department was an independent provider. And when we asked her to review her ledger and her receipts, she had a ledger, but she brought us a shoebox. And there was no rhyme or reason to the receipts. It was just literally a year's worth of receipts that she had just put in a shoebox. And so to be able to match a receipt with the date that a transaction occurred, you can imagine it was a lot of work. So we don't want to make more work for reviewers. So a little insider tip, the more work a reviewer has to do, the more ability to find areas of citations. So when I can very clearly say, here's the January ledger, here's all the January receipts in chronological order, that are stapled or attached to the ledger for January, and that reviewer can go through it, click, 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 there is going to be less likelihood that they are going to stumble upon, other issues, right? So the Friday file fix is really just meant to be, this suggestion that once a week you just go through your documentation process, however you're keeping records, and just did I do everything I needed to do? Because it's a lot easier to fix it on a weekly basis than it is to fix it, for a whole year within 90 days of getting a review. The daily 2-minute documentation checks, again, that's just quickly, did I actually document for the day I provided the service? Did I sign off on my documentation? Did I, check all the boxes? So each day at the end of the day, whenever you provide service, just a quick little look at, did I do it? And then a monthly self-review. So I recommend that you actually take a look at the compliance tool, maybe go through and highlight, this pertains to me. Yes, I do this a lot. Oh my goodness, this is something I think is really important. I know the department's going to think it's important. Like, highlight on that tool those things that each month you just want to sit down and say, oh, I know MUI, that's going to be a big thing for the department. So you highlighted, like, did you do your monthly, MUI review or whatever, right? You highlighted that and you're like, each month I want to look at this and make sure that I did it. So use that at your advantage. Take advantage of that. Cindy, sorry, you may have joined us a little bit late, so you can find that on the department's website. And at the beginning of this session, I went through step by step how to find it on the website. So when you get your email that has the recording of this session, you can go back and look at that, and it'll show you just step by step how to go on the department's website and where to click so that you can get to that compliance tool.
And
And then
just
Fred,
real quick as well, if you scroll up, Cindy, and others, I put the current review tool as a PDF in the chat box. So if you're on your
thank you, Haida.
computer, you have the
This is why it's a
ability.
two-person show here.
It's all good. You
Haida's
can
got my
click,
back.
you can click on the download. If you're on your computer, you can go ahead and download that right now. But we also put in the chat what Anne's speaking about with where to go on the website to find those things. So all those pieces together, I think we gotcha. All right. Thanks,
Yeah,
Cindy.
we have your back, Cindy. And if all else fails, if you download it and you look at the recording and you're like, I lost the download and I still can't figure out how to find it, our email addresses are here. You can shout us out anytime and we will be happy to show you. So, um, all right. Speaking of the documents on the website, again, one of the documents that we talked about was the independent provider required documents list. And so the second tip for you all is keep your records organized and in one place. And I think that documentation list should drive what your organization looks like. So you can create maybe a review notebook or a compliance folder, or if you already have some type of a notebook that you've put together for the person you serve, that's got the service plan in it, it's got your doc sheets in it, it's got the financial ledgers in it, whatever, maybe go in and put little tabs on the ones that, oh, this is a required one they're going to look at when they come to do a review. Not only is that going to make it easy for you to hand the reviewer the person's folder and say, oh, the blue tab is MUIs, the green tab is financials, whatever, right? It's also going to help you go back to the first practical tip, which is repeatable compliance habits. So when you're doing review, you can also go look at those same sections and just make sure that, okay, that's a required document. Yes, I have it. It is up to date. And I'm ready for that review. Strengthen your documentation game. So I use an acronym when I train people called WHIP. And that's what, how, individual response, and progress and problems. So when I'm documenting, not only am I filling out those required elements for the documentation sheet, what time did it start? Where was the location of services? What's the name of the person that received the services? All that kind of stuff that's required. Am I also keeping a documentation record that helps me evaluate the outcome of the services I'm providing? And WHIP, describing what the service was you provided, how you provided it, what the individual's response was, And was there any progress? So, really great things that happened. Like for the first time, Anne was able to independently sign her own checkbook or her own check or whatever, right? Documenting those so that when the review occurs, you have a really great way to explain a situation to a reviewer. I always said documentation should tell the story because as a reviewer, even when we're coming out, even when we were coming out to do special reviews, it really was. We're just trying to get the story. Like, what happened? We need to know what happened, right? And sometimes the story can explain things so that it's like, oh, you did do exactly what needed to be done. You did, implement things appropriately. And sometimes the story is we missed something and we need to correct it and figure out how to do it. But WHIP will help you make sure that you are documenting in a way that it tells the story. What happened? How did I address it? Excuse me. What was the individual's response? And if that response led to either progress or a problem, I've identified that. And then if it's a problem, I've taken the next step of how do we solve that problem. And then you can strengthen your documentation game again with that 2-minute documentation check, making sure that you are doing same day documentation. It is very apparent to a reviewer when you are doing a month's worth of documentation at a time or a quarter's worth or even a year's worth. Sometimes there are just little signs and signals. People don't use the exact same pen for a whole month. uh, People do always have the exact same, you know um, uh, handwriting every single month. They're just little indicators that as a reviewer, it's like, man, it really looks like potentially that the provider is only document same day documentation is really important because there are that you can kind of make it more apparent that you really truly are documenting as services are being provided. Keep your billing clean and defensible. So make sure that you are double checking your units against your documentation. Make sure that you are completing EVV and make sure that your billing is matching your documentation. It's really easy, and this isn't always a compliance issue. This is also helpful when it comes to accurate billing and not having to deal with billing errors and having to make corrections, right? But it is also something that the compliance reviewers do look at. Is there an indication that services aren't being provided as directed by the plan because there are, you know, 200 of the 500 units for the year were never billed. Well, that's a clear indicator that maybe the services aren't being delivered. Or the person had 1,000 miles allocated to them for the year and they used them in the first 2 months. So, is that a compliance issue where the billing and documentation aren't correct? Or is it an issue, which can still be a compliance issue, that the provider didn't reach out to the SSA to have a conversation about someone's needs have changed? Maybe someone's health condition has changed. And when the plan was originally written, they weren't having to drive to Cincinnati Children's Hospital, twice a week for therapy or something. And now they are, and you're using up those 1,000 miles really quickly. And there is an expectation in the review tool and in the rules that providers are communicating those changes to the team so that they can be addressed. So while billing isn't necessarily an integral part of the review process, the department doesn't issue citations based on how you do your billing. Billing can be an indicator that there are service delivery issues. So making sure that you have clean and defensible billing. Okay, next one. Maintain your required trainings and certifications. So make sure you know what those are. Obviously, there are general training requirements for all providers, but then there are also some training requirements that are built into the service plan because they're specific to the person that you serve. Or maybe there is a training requirement that is specific to the service that you're providing. Um, and certifications. So certifications can be as simple as I'm a provider of transportation services. Did I go renew my driver's license when my driver's license was due? So maintaining a record that helps you meet those timelines, gives you reminders that something is expiring, your CPR, your first aid, your driver's license, and having a way. Technology is great, like utilizing the reminders on your phone, but being able to tell the reviewer, like, here's how I do this. Here's how I make sure that I keep my CPR and first aid up to date. And you know what? You're right. My CPR was expired for 2 days. Here's the documentation of I reached out, I signed up for the class, the next class, da da da. Oh, and I do have a system in place that since I missed that, I've put a system in place of virtual reminders to remind me. It may not keep you from having a citation, right? But self-review and self-correction is always worth discussing with your reviewer so that you are able to say, look, I have already identified this. I have already come up with a system. Worst case scenario, you get cited and you already have your plan of correction written. Best case scenario, you have a conversation with the reviewer looks at it, and they've determined you really have put ample protections in to keep that from happening again. So keep your demographics current. We talked about that, how important it is to make sure that the department and others, county boards, et cetera, can get in contact with you. The other reason that keeping your demographics current, not from a compliance standpoint, is that's also the contact information that the department puts on their website for the provider search tool. And I hear so many times, and I see on social media, many independent providers who are concerned because they're having a hard time finding people to serve. And sometimes it's because your name is out there. It's on the state's provider search. It may even be signed up for however your county board is doing free choice of provider, but you didn't update your email address or you didn't update your phone number. And so people can't get in touch with you. So even aside from a compliance perspective, that's another reason to make sure you keep your demographics up to date. And then maintaining your training records, making sure that when you get your certificate from today's training, you have a place for that, you're maintaining it in a certain place, and you're able to, again, show that you've met those training requirements by having training records that not only are accessible and you have available, but that also meet the requirements for a training record. So it has to indicate the title, it has to indicate the name of the presenter or the organization. It has to have the amount of time, either a start and end type time or a duration, like 1 hour. And it has to have a brief description of the training. I think that's the four things. Heidi, is there anything else on training? I think it's those four things.
I think you got it. Yep.
Okay. Okay. Also, use a simple CQI loop. So we just did a training with agency providers right before you guys, and CQI is something that most agencies are familiar with that term. You guys may not be, and it just stands for continuous quality improvement. And so looking at, even though you're an independent provider, what are some things that I can do to make sure that I'm staying up to date, that I am continuously reviewing my systems, the services I provide, and that the outcomes of what I'm doing are likely to lead to quality for the people that I'm supporting. And so we talked about that, the self-reviews, staying up to date, subscribing to notifications from the department, attending trainings, things like that. So just kind of evaluate your service delivery model and what can you do to constantly improve that model and make services better for the people you support. Build strong relationships. Make sure that you have a good relationship with the SSA. You are that line of communication to that team. You are the person who is actually seeing in action the response of the person you serve to the services that are being delivered. You are oftentimes the first person who sees a change in someone. What's going on with John? He seems more irritable. And then that leads to finding out that he's got an impacted wisdom tooth, but he wasn't really able to communicate that to you. And so it took a little bit of kind of sleuthing, being a detective to figure that out. But you're going to see that much more quickly than the SSA is or anybody generally on the team. And so making sure that you have that partnership where you can pick up the phone and say, we've been dealing with some behaviors, somebody has been refusing services and we aren't quite sure what, but you know what? We went to the dentist the other day. We found out there's an impact. So make sure you're having those conversations and you have that relationship where you feel comfortable in making that call. Building strong partnerships with the people that you serve and their families. Many times you're going into their home. You're going into the person's home. You're going into the family's home. Evaluating what you're doing in the home. Are you inadvertently restricting someone's rights? Are you respecting their boundaries, their culture, their religion, their food preferences? Again, just keep those things in the back of your mind because that's what helps build strong partnerships and relationships with the people you support and their families. And it leads to satisfaction with services. It leads to better outcomes for them. It often makes your experience with the person better or with the family better. There's nothing like a strong family advocate. Parents are the best advocates for their children. But as a professional and a provider, that also makes sometimes the most challenging relationships that we have. And so, what can you do to build those relationships and foster them? And then also with your colleagues, Network 19 is absolutely meant to be a place to network and engage with your colleagues, to learn from each other, to mentor each other. And building strong partnerships with your colleagues helps you identify, other initiatives and, best practices that you yourself may not be thinking about. And then if you're not familiar with it, look up Just Culture. Just Culture is a framework or a mindset that's based on human error happens. And most of the time, when there is an error, it's not intentional. And that when I do make an error or I self identify an error, I need to feel comfortable and not taking it the wrong way, that I take it as an opportunity for learning, that I seek out experts, support, resources to better myself, to look at systems and ways that I can make sure that that doesn't happen again. And so I know I've dealt with and experienced a lot of situations where providers really beat themselves up for things that were not intentional, for things that truly could have happened to any of us. I mean, literally letting your driver's license expire. Like we are all busy. We all have kids. We all are, have commitments and responsibilities. So those things can easily happen. So just be humble to yourself, be graceful, give yourself some grace. And that really is all that Just Culture means. But it will help you be prepared and ready to deal with any compliance issues that may come up. We've got that's it. I thought we had one more slide, but that is it. I got to get better at timing myself because I haven't left any time for conversation. But we are certainly open to comments or questions. I'm available to stay on for a few more minutes if there's anybody that wants to chat or has any questions. But let's give it a couple minutes. And if you have anything, let us know. So Adrian is asking, could you put the PDF in chat again? So if it was put in before someone came, they won't be able to see it. So let's see if we can put that back in again. Thank you. And then also, could you provide a link to where demographics can be updated? So that's going to, yeah, if you can stay on, I'm going to put that in here on the DODD website. under supporting providers, there is at the top a bunch of how-to guides. I'm hoping they're still there and they haven't been deleted. Change of demographics. Here we go. Copy. And I'm going to put that link in here right now for you. There you go. So that's a guidance document that DODD put out that shows you step by step how to go into the PSM system and update your demographic information. All right. So you guys are very welcome. Thank you so much for taking time. Thank you so much for what you do. We know how important the work that you do is. We understand that taking an hour or an hour and 2 minutes out of your day to join us is sometimes a struggle. We know that you balance work and home life and personal life, and that's not an easy balance. But we are here to make it a little easier in any way we can through resources and support. So please feel free to reach out to us. Now look at that. Haida, on this one, I put my email address and didn't put yours. All right, so I'm putting Haida